What's going on, folks? Welcome to Kids Today with Dr. Kamal Jones. I am Dr. Kamal Jones. Fresh off the press, the NIH has just announced that it is going to be making an immediate $4 billion cut to America's research infrastructure, a massive change that will greatly impact folks curing childhood disease and all other types of research throughout the country. But first, before we get going, be sure to like the video, subscribe if you haven't already, hit that notification bell so that we can get you up-to-date information. So, let me explain what happened. This past Friday, the National Institutes of Health, otherwise known as the NIH, announced that it was cutting funding for the infrastructure and administrative costs, otherwise known as indirect cost of research projects, down to a cap of 15% from what had been an average of around 30%. Now, bear with me for a moment. Let me explain what that actually means. So, indirect costs for research are designed to cover all the stuff that universities provide that just don't really make sense for individual researchers to be able to put into place. Things like physical lab buildings, ethics review boards, electron microscopes, an HVAC system, stuff that scientists can't really build or purchase themselves every time there's a new experiment to work on. Universities individually negotiate these indirect costs with the federal government, and they can really vary depending on where the university is, the amount of resources that the university provides, things of that nature. Let's just say, for example, a scientist is working to find a cure for a childhood cancer at a university that has an indirect cost of 30%. If a researcher gets a grant for $1 million from the NIH, an additional 30% or $300,000 will also be sent to the university to cover those indirect costs that I mentioned, right? Upkeeping costs for the laboratory building or paying for hazardous waste disposal, things of that nature. So this new rule from the NIH would cut that in half to 15%, or in this case, by $150,000, which could mean that the university can no longer afford that important electron microscope or to pay that lab staff. And that experiment, which may have been the next treatment now for asthma or the next cure for type 1 diabetes, or as I mentioned, childhood cancer or a whole host of other childhood illnesses, that experiment may not be able to be completed because now it is just too expensive. So, as I said at the top, overall, this is going to represent an immediate $4 billion cut to America's research infrastructure. I say immediate because it is quite literally effective immediately, including projects that are currently running, projects that had already been budgeted, projects that are happening today, have been happening for months. Scientists around the country are sounding the alarm on what this means. Take, for example, Dr. Andrea Love, who tweeted that this cap on indirect costs will kneecap biomedical research. We're talking staff cuts, lab closures, fewer research projects, loss of talent. It is something that can jeopardize us leading scientific and medical innovation. This message from Dr. Lucky Tran said that I can't emphasize enough how disastrous the NIH cuts will be. If implemented as proposed, it can decimate universities and colleges, can mean that every one of us in the US and around the world will experience shorter and less healthy lives. So, what can be done? By early next week, we expect that there will likely be court cases flying in from around the country, looking to put a hold on this change, citing that the NIH and the White House likely lack the authority to make this change without congressional approval. We'll be watching closely for that. We have seen time and time again this White House try to stretch the bounds and the limitations of executive power. But beyond that, who we really need to hear from are the scientists of our country. We need you all to be front and center, yelling from the mountaintops about how this will impact children and families and every type of research going on in this country. And so to that end, I want to just take a moment to plug an upcoming event from the Union of Concerned Scientists. On Wednesday, February 26th, they're going to be hosting a webinar about how scientists can engage in advocacy and to do so in a way that keeps you protected so that you can use your power while still continuing to do your really important work. And so for all of our scientists, our researchers, our physician scientists, please check this out. I will put the link in the description box. We absolutely need your voices in this work. Okay, folks, that is our show for today. Thank you for tuning in. Please make sure to like, subscribe. Please leave a comment. Let me know your thoughts on this, right? Do you think we need to be making cuts to research? Do you think this is an overreach from the government? I would love to hear from you. Until next time, this is Kids Today.